Hey YouTubers, it's Dave here, making another video for the end of the world, some sort of disaster, a situation where you are left to your own devices. And today's topic is on pain relief. And I think pain relief for an SHTF, rule without law situation, is absolutely vital. You've got to have some sort of pain medication. Some time ago I had a very severe condition with my hip. It required a lot of surgery, and I really found out what pain was all about and how debilitating it can be. It can really destroy your life. And you can almost guarantee that in a SHTF situation, people are going to be hurt. It could be you, it could be a loved one. So this is just a little video about pain medications. Let's start off with the ones that you can buy over the counter. The first one is aspirin. It has anti-inflammatory effects. It's good for headaches and minor scrapes. Do not give to children ever, because it can cause quite a severe reaction. It can even kill children. So aspirin is for grown-ups only. It has very, very minor pain relieving abilities. It's good for arthritis and things like that. Bad for the stomach if you use it long term. Still, it's something that you can have in your bug out bag. The second one is paracetamol. In my side of the world, in America, you guys call it acetaminophen. Once again, that's available over the counter. You can take up to 3,000 milligrams a day with acetaminophen, but you must be very careful. It is very toxic to the liver. Usually in doses, maximum doses of 1,000, 3 times a day. All right, but and that does have a lot of, it reduces fever as well, so that's very useful as well. And it has very mild pain relieving abilities as well. The next step up, but also available over the counter, is a combination of acetaminophen, usually about 500 milligrams, with 8 milligrams of codeine. You can get them a little bit higher. It just depends on your own country's rules as to how high the codeine goes. In my experience, if it's over the counter, it's never anything above 12 milligrams. But you need to check with your own country to check out what's legal, what can be legally bought over the counter. That has mild to moderate pain relief as well, because the codeine works well with the paracetamol. The fourth item that you can buy over the counter is ibuprofen or ibuprofen. You can take up to 1,600 milligrams a day and divide that into 3 doses usually. It's an anti-inflammatory drug. It's good for a whole range of different scrapes with its anti-inflammatory effect. So it's definitely something that every bug out bag or first aid kit should have. Alright, now the next lot are things that usually require a prescription. So of course follow your doctor's advice and obey all the laws of your particular country as to what you can do. The next one, number 5, is what we call Panadine Fort. I believe in America it's called Tylenol 3. That once again is a combination of acetaminophen, usually about 500 milligrams, with about 30 milligrams of codeine. In America, I believe it's called Tylenol 3. You can get Tylenol 4, which has the same amount of paracetamol, but it has 60 milligrams of codeine. Now, these drugs are addictive. It's an opioid. Well, the codeine is an opioid, and any opioid has the ability to become addictive. But these are good for moderate pain type responses. Unfortunately, number 6 has just been banned in America, I believe, and a few other countries have followed suit, and that is the propoxyphene. In America, it's known as Darvocet or Digesic. My side of the planet, it's Capodex, and I still believe we use it in Australia. Not that I live there, but Capodex is still going. It has been removed because in America because some people developed heart conditions over a long time, but it was a very small percentage. It's a real pity that it's been taken off, actually, but there you go. All right, this is something that's pretty much American or North American, is Percocet oxycodone, highly addictive. It's good for moderate pain responses, but terribly addictive. Now, the solution to an opioid that's not so addictive but has good pain relief is a relatively new drug called tramadol. When I say new, it's not that new, but compared to the others, it's new. It is a synthetic opioid, and but it doesn't have the great addictive qualities of other opioids. You can take 100 milligrams 4 times a day. Some people say that it's good for moderate to severe pain, and some people suffering from cancer actually take tramadol. Having been on it for some time when I was ill, I can tell you that it's not as good as people think, but still it is very, very effective, and it's usually got a lower prescription level, because all prescriptions have different levels. The more the addictive the drug, the higher the level. So this is quite a low level drug, and it's available over the counter in many countries, but I don't think it's available in America. Okay, let's move on to, oops, we knocked down a few things there. Some different types of painkillers. Let me just get the camera up here. Alright, now the gold standard for any type of pain is morphine, highly addictive, usually used in end-stage cancer or very, very severe. After you've had an operation, they might give it to you for a few days. It is the gold standard when it comes to pain relief. Of course, it's very difficult to get your hands on that, unfortunately, or fortunately, depending on what your views are. I've included 2 nerve pain drugs because I've suffered from nerve pain before, and it can be quite debilitating. The old type was called Neurontin, and the new drug that they have for nerve pain is Lyrica, and it's very, very good for nerve pain. They use it for a whole range of different conditions where people are suffering from some sort of nerve pain because they've damaged their nerves in some particular way. So it's quite effective. So if you do see that, I mean, this just to let you know what it is. Alright, some other types of drugs, and I can't include everything in this video. I've put in a drug called Norgesic, which is a muscle relaxant called ephedrine citrate, and that has acetaminophen in it as well. It's a very good muscle relaxant. You've got benzodiazepines, which are also addictive, so you must be very, very careful with those, like Valium. There are other benzodiazepines that can be used for muscle relaxation and anxiety and tension and things like that. That could be very useful depending on what sort of condition that you have. 14 is a drug that is still used in some countries. It is a very effective muscle relaxant and also analgesic, and that's phenobarbital, but you'll have a hard time finding it if you're living in a Western country. Many Western countries have gotten rid of it because it is highly addictive. And the last thing that I've put in there is topical analgesics, something that you can put on your skin or a wound, and that is lignocaine, lidocaine, xylocaine, which numb a particular area. If you put the gel on or the cream on the skin or the wound, it it causes a numbing effect, so you can't feel the pain. It's something that you probably get a lot of if you go to see the dentist and they have to do drilling. They'll give you a shot of lignocaine. Now, it's difficult to get in its injectable form, but buying the jelly or buying the cream is over the counter and can be used effectively. So you can actually buy that over the counter. My last recommendation would have to be cough and cold medicine. If you live in a place where the regulations for obtaining analgesics is very, very strong or very strict, a good idea to put in your bug out bag is cold and flu medication, because it has a whole range of different things in it. Sometimes it has aspirin, sometimes it has paracetamol, and very often it has antihistamines like pseudoephedrine as an example, that can really help out in different pain states, as well as for colds and for flus. And you know, if you've been hiking all day or whatever, you've been on the run and you've got you're aching in a lot of places, a lot of the time cold and flu medication can be very, very handy as well. Okay, now just remember, follow your country's laws, follow your state laws, and certainly don't use this. Get advice from a medical professional before you try and get anything that requires a prescription. All right, but then again, remember, this is a SHTF situation, and this is just to give you some background knowledge on different painkillers that are out there. Okay, thanks.